This online video, in the style of a horror movie trailer, certainly gets its message across. But according to the charity Pancreatic Cancer Action, still not enough people are taking heed and checking for the symptoms, which include yellowing skin, weight loss and stomach pain. Real-life movie stars are just as prone as the rest of us. Derbyshire-born actor John Hurt announced last June that he's battling the disease, and Shakespearean favourite Alan Rickman died last week as a result of it. Pancreatic cancer is the UK's 5th biggest cancer killer. There were 820 cases in the West Midlands last year, about equal numbers of men and women. Only 33 survived. And only 3% of GPs are confident of diagnosing pancreatic cancer instead of other conditions. Sandra Francis from Evesham knows that only too well. She lost her husband Pete in December 2012. He was first diagnosed with diabetes, but around 4 months later, at the Alexandra Hospital in Redditch, the couple found out the truth. By then, it was too late to operate.
We'll never know, or rather I'll never know, would that tumour have been more operable had they queried the diabetes diagnosis way back in September, October. That's my concern, that people need to be diagnosed much earlier and get to the point of operation, if it's possible, much, much quicker.
Currently, 80% of patients are diagnosed at a point where their tumour has already spread away from the pancreas into other organs. So they are facing a prognosis of about 4 to 6 months on average. But if you are diagnosed in time for surgery, then your chance of surviving 5 years increases tenfold.
40 years ago, few children survived leukemia. Now 80% do. 40 years ago, only 46% of women with breast cancer survived. Now, again, 80% do. But 40 years ago, only 4% of people with pancreatic cancer survived, and today that figure is unchanged. Spotting the symptoms early can mean a better chance of survival. Ignoring them will almost certainly lead to one thing. Andy Bevan, ITV News.